Hello, today we'll discuss Alzheimer disease. Let's begin. It is a progressive disease that destroys memory and other mental functions. Here, brain cells degenerate and die. So, what do we mean by a progressive disease? Progressive disease is a health or disease that gets worse over time, resulting in a general decline in health or function. So Alzheimer is a progressive disease because it gets worse over time. Okay, not sudden. This disease is named after Dr. Alois Alzheimer. Okay, a little bit of history. In 1906, Dr. Alzheimer notices changes in the brain tissue of a woman who had died of an unusual mental illness. Her symptoms include memory loss, language problems, and unpredictable behavior. So, after she died, Dr. Alzheimer examined her brain and found many abnormal clumps. These clumps are now called amyloid plaques, and he also found tangled bundles of fibers. These plaques and tangles in the brain are still considered some of the main features of Alzheimer's disease. Now, what are these plaques and tangles? Plaques are present between the nerve cells. Please pay attention. They are present between the nerve cells. They are clumps of beta amyloid. Beta amyloid is a piece of protein. So when these beta amyloid proteins clump together, they form plaques that can disrupt communication between nerve cells and cause brain inflammation. And what are tangles? Tangles are present inside the neurons. Inside the neurons or nerve cells, they interfere with the cellular machinery used to create and recycle protein, which ultimately kills the cell. So these planes and tangles in the brain are considered some of the main features of Alzheimer disease. These are toxic proteins. This beta amyloid and tau, they are toxic proteins. They accumulate and form plaques and tangles throughout the brain. Okay, so this is the basic reason for this disease. Now its symptoms range from mild to moderate to severe. In mild conditions, what happens? Here, people experience greater memory loss, wandering, and getting lost. They repeat questions again and again, and we find personality and behavior changes in them. What about in moderate? In moderate conditions, damage occurs in areas of brain that control language, reasoning, sensory processing, conscious thought. Memory loss and confusion, it grow worse. They have difficulty recognizing family and friends. They are unable to learn new things. They may have hallucinations, delusions, paranoia, and they may behave impulsively. And in its severe case, these patients cannot communicate. They are completely dependent, and near the end, they may be in bed most or all of the time till their death. Okay, so this was Alzheimer disorder. Hope you understood. If you have any queries, you can put your queries in the comment box. Okay, thank you students. Take care. Bye bye.